let's talk about mindful eating in diabetes care. And when we talk about the problem in diabetes management, we need to acknowledge this behavioral gap. And we are trying a lot of fascinating things, lot of great therapeutics, insulin, GLP-1, SGLT2, and many things. But 20% of our patients, they are having that sweet HbA1c control. So what is the answer to that? One of the very important story is our patient are not adherent to therapy. So poor adherence along with eating issues, emotional eating, stress, these are few important challenges. So we need to have certain interventions that regulate both the metabolism and behavior. So this is an important statement. You can't medicate your way out of a problem you behave your way into. So that is why mindful eating is important. And when we talk about mindful eating, it is that eating with intentional awareness, presence, and non-judgment. Origin, of course, this is rooted in our ancient texts, the Vedic times, Vedic practices, along with that Buddhist contemplative practice. There were this theory of mindful eating. And later, it had been reinforced by yogic traditions of awareness, all those dhyana, sadhana, and the goal is shift from impulsive, emotional, or stress-driven eating toward conscious nourishment and self-regulation. So mindful eating is not just a diet, but a way to rebuild our relationship with food and to understand that we are the food. In the Rig of Rig Veda, our ancestors had told Aham Annam. So let's remind that we are nothing but what we eat. And is there any science, especially when we talk about mindful eating? Modern physiology researchers, they had suggested and had shown multiple areas, multiple physiological action by which mindful eating affects. And if we start from the hormonal regulation, the stress-induced hyperglycemia, the hypercortisol level that can be decreased by mindful eating, along with the balance, the homeostasis with ghrelin and leptin, the hunger and satiety hormones, that also being established by this mindful eating. Our autonomic nervous system, we know the dysautonomia, sympathetic and parasympathetic dysautonomia, which is a very important factor behind insulin resistance and hyperinflammatory state inside us. But this mindful eating increase the vagal tone, correct the parasympathetic dysautonomia, improve insulin sensitivity, and reduce the inflammation. In brain, the amygdala reactivity will be decreased, so we will have less emotional eating, less cravings, and also it improves the insula activity. So that will translate into stronger interoceptive awareness. That means the hunger or fullness cues will get. So to sum up, mindful eating bridges stress, regulation, metabolism, and behavior supporting improved glycemic control. We have many emotional issues with eating, and there are certain behavioral science research which had uh, told us these interesting findings. Number one, that it decreased emotional eating, which is being introduced by stress and mood-driven intake, improve dietary adherence, sustainable lifestyle change, decrease the binge eating disorder symptoms, and overall, it improves the quality of life and self-regulation. Long-term impact was positive outcomes which persist beyond program completion, and that suggest habit formation and durable behavioral change. These are few interesting original research and systematic review meta-analysis which had shown both the subjective and objective benefit with mindful eating. There are multiple practices, but most of them had been conducted in Western world. Though the source of this practice is in our culture, ancient India, Vedic India, but the research conducted by our Western colleagues on this, and they generate the evidences. So it is high time for us, the researchers who are doing metabolic syndrome related research on this intervention. When we talk about mindfulness-based eating, if we need to know these 6 core practices. Number one, present moment sensory awareness. So first stage will be engage our sight, smell, taste, texture, which slow the eating and improve the satiety. Next step would be internal cue recognition. So we need to notice the hunger and also the fullness signals, which will prevent the overeating. Next, craving acceptance, urge surfing. So we need to observe without reacting impulsively. Then decentering from food thoughts. See cravings as transient, compulsive patterns will be decreased then. And reduction of the different distraction. Eating without multitasking, very important in these days. We often eat without understanding what I am eating. We use our mobile, our Facebook chats, our WhatsApp, and we eat. So that is totally need to be stopped. And especially, we need to educate our young generation. I think Sunil Banerjee sir will agree. Very recently, the study had been published. Under 16 or under 17 years, so many children are suffering from hypertriglyceridemia. What is the cost? If we go to our family, we can see the infants also, they are getting their mobile, they are seeing certain cartoon, and their mother making them eating. What we did in our past days, I think that was also one practice. While eating, we cannot talk also. So if I am during the eating time, if I talk, I have to leave the food, and we have to get up. This was our tradition, but we are going far from our tradition. We are coming near towards so many diseases. So we need to reduce distraction during eating, and we need to also trigger the awareness, identify the internal, it could be certain stress, boredom, or external, certain ads, social cues, certain we now in the television, so many ads, and they also are the drivers for this type of binge eating. So generally, the mechanism of these 6 steps would be, it will strengthen the prefrontal control and support the self-regulation, ultimately lead to sustainable eating behavior. And when we talk about this mindful eating, it could be considered as anna yajna. And in Indian tradition, if we talk about, so many examples are there. I have taken few examples from Sri Ramakrishna. He often educate his disciple to consider Anna as Brahma. Anna is Brahma. Food as divine essence. So we need to consider that. At the same time, Sarodha Ma, she told how we can express bhakti through cooking. So food as seva, service. And we all chant the great Annapurna Stotra by Adi Shankaracharya, where he told again and again nourishment as a grace. So Annapurne Sadapurne, we always chant this mantra, and each line of that mantra actually told why we consider eating as Anna Yajna. So when we talk about eating as a sacred ritual, that is Anna Yajna, just think about it. Just imagine you are doing one yajna, Agni is there, and actually that hunger, our hunger is that Agni, the digestive fire. Then the food, it is that oblation to that Agni, that is to be considered as sacred offering. And who is the priest here? Who is the Ritvik here? We are the Ritvik here, the eater. And the awareness, that will be the consciousness we gather, and it could be considered as sanctifier. So we need to be part of this Anna Yajna so that we could have a mindful eating. So reframes eating from just a habitual act, and we will get an intentional ritual here. It enhances mind-body alignment, support better glycemic regulation and adherence. What could be a teaching tools for us prescribers? So we could practice certain structured items. For an example, this raising meditation is very popular in different parts of the world, which engage all 5 senses, slow down the eating. Hunger check-ins, which distinguish physiological versus emotional hunger. Gratitude rituals, which honor the food's sacred and ecological origins. And when we talk about 7 mindfulness attitude, number 1, non-judgment. Number 2, patience. Number 3, beginner's mind. Number 4, trust. 5, acceptance. 6, letting go. And 7 is non-striving. Actually, if we use these tools, it could transform eating just from a mechanical act to a therapeutic ritual, enhance self-regulation, adherence, and emotional resilience, especially which is very important in diabetes care and other treatment of metabolic disorders. Just few points about raising meditation. The raising meditation is a classic mindful practice introduced in different MBSR based protocol. It involves, number 1, taking a single resin and observe it fully. We need to observe color, texture, smell, weight. Then slowly placing it in mouth, chewing with full attention, noticing the taste, texture, and bodily sensations, paying attention to thoughts and feelings that arise during the act of eating. It actually trains sensory awareness, the five important sensory awareness: sight, touch, smell, taste, sound. And it also breaks the automatic mindless eating habits. It cultivates interoceptive awareness, the hunger fullness cues, what we had been discussing, and demonstrates how presence transform the eating into meditation. So it could help patients to recognize emotional versus physical hunger, promote slower eating, better satiety, reduce the overeating, and also it supports the glycemic regulation by reducing impulsive food intake. And this had been seen in multiple studies, clinical studies. Coming to how we can measure these issues. Now the digital delivery tools are coming up. Few mindfulness apps are available which guide meditation, micro check-ins. There are certain telehealth platforms also. We can use it in GDM patient, obesity, metabolic syndrome patient, those who are suffering from stress-related eating. And that actually help us in improving the adherence by real-time self-regulation. It is scalable, low-cost adjunct to conventional diabetes care. No extra risk. And it could be expanded. It can reach to underserved and remote population. So when we talk about digital mindfulness-based eating delivery, which could bridge the gap between clinic-based therapy and daily self-management. So to sum up, why diabetologists should consider mindful eating? We have now enough evidences. By these techniques, we can improve the HbA1c control, BMI reduction, emotional regulation. It bridges the behavior, metabolism, and the meaning of life. It aligns with biopsychosocial spiritual model. Culturally sensitive for Indian population, because this is our ancestors' training. It is low risk, high impact, and obviously evidence-based. So future, it is about standardized protocols, digital delivery, and spiritual context tailoring. So this is one thing I just want to conclude. And this is my last slide. And we are observing now Navaratri, the Matri Pakho, and we are celebrating the essence of mitochondria. Just from our article, I want to mention this specific lessons which we gathered from Sankaracharya, the great Sankaracharya. He told, Aham bhojanam naivo, bhojjang na bhukta, Chidananda Rupa, Shivoham Shivoham. I am not the experience, not the object of experience, not even the one who experiences. I am the form of consciousness and bliss. I am Shiva, that which is not. So this is very important. Often, in simple, we should search the pleasure from within, not from the outside. And this is the very important truth of all our life. Generally, this had been taught by our teachers only. Simple example. Sometimes when our juniors smoke, teachers told one of our junior, try to find or try to search the happiness not from buying outside things like your cigarette, trying to get it from here inside. So I think just like that, this eating also, urge of eating, we can control if we use this mindfulness-based practice. So thank you very much once again for giving me this opportunity to learn this topic once again. Thank you very much.